Ajay,
Hey,
it's been a
long
while. How
time.
have you
Yeah,
been?
it's been a long while.
The world's a crazy place, huh?
Yeah,
Awesome. So yeah, how have things been going for you? Good.
things been fine, and I'm guessing you already know about what happened with the merger, the acquisition last year. So a lot of things happened over the year, and yeah, so here we are during COVID and still doing a lot more than before.
Yeah. Have you seen since COVID a lot more traction in terms of people interested in your solution and looking at how they can really deploy robotics more into the system?
Oh yeah, absolutely. Like pre-COVID era, a lot of things were not even considered as kind of the priorities, which have changed. When we talk about disinfection, it has a lot of focus that has been brought in during this COVID era. Um, the other things. Hey, Aisha.
Hi there. Hi,
Oh.
Kevin.
Hi, how are you?
Doing very well. Thank you. Apologies for the tardiness.
Yeah, good to meet you.
Very nice to meet you too.
Yeah,
Go on, guys. I'm so sorry about breaking the flow there.
no problem.
Yeah, so basically we had a lot of, so that's kind of the reason for the merger as well, where we kind of observed that there's a heavy shift towards the requirements that hospitals and the healthcare would require, and going forward it was more of bringing in more of automation, as well as looking at it as a perspective of delivery of UV, delivery of medicines, delivery of the patient care. But we
Yeah.
looked at it from a perspective of what can robots deliver to a healthcare partner. So yeah, that's where we approached it from, and we have an array of services now.
Yeah, it's really exciting, and there's for me the way that I look at it, there's just so many possibilities. You look at the use cases, and what you could do with automation and robotics within the healthcare system. I mean, it's almost endless in terms of where you get started, right? Because there's so many different needs and so many different experiences that can be created to optimize the system.
Yeah.
Great.
Perfect.
Absolutely. So,
Yeah.
if you remember when we started with earlier, we had kind of the offering of medicine transportation as the primary focus, and that wasn't a new concept back then. It existed in US as Aethon TUG, in Europe, in Japan as well. There, we had Panasonic. There are multiple companies doing it here and there, but kind of the focus was brought in during COVID, where you know we saw at least a rise of 40 new companies doing just medicine delivery during COVID, right? So that's the new kind of focus on the healthcare related innovations.
I think another thing that really contributed over here was also the fact that suddenly you were dealing with a situation where you couldn't have too many people in the ecosystem of actually delivering medical care. And more so in a place like India, because I don't think Asia Pacific had really grown to appreciate automation to such a degree as they do now. And that entire ecosystem changed, and then the need suddenly grew that much. It was just that much more intense. I think Ajay will be able to definitely validate that. But I think just the number of requests, just the amount of interest that happened in these matters was crazy over here, especially when we look at India as well.
Yeah, it makes a lot of sense. So,
True.
w-
I
where
think
do you,
good timing on these.
yeah,
Like, it's a sad situation, but it was good timing. I think it was the need of the hour.
yeah. I mean, I think there was such an immediate shift in need for new solutions in
Absolutely.
2020, and certainly, I don't think those needs have gone away as we
Mm-hmm.
kick off, 2021. But I'm curious, where do you guys see things going, in the next few months and through the end of this year and beyond? What do you see happening?
Yeah.
Go on,
So
Ajay.
going ahead, we do see as in a lot of focus on the looking at robotics as a solution, not just to see it as the replacement of people, but then to complement them in a variety of ways. So when we look at and primarily this is also happening because the mass scale production is bringing down the cost of these robots, making it much more affordable than before. Like we used to talk about these robots at being at $100,000 out in the which we even the which was hard for even the premium hospitals in most cases. When today we are talking about somewhere between 10,000, 15,000 range, where and still competing further down, right? So the massive scale, it's bringing some kind of revolution that the automotive industry had bought a few years back. So many years back, actually. So that industrial revolution that we talk about, Industry 4.0, is definitely applying over here, where we see robotics being one of the propellant over there, and the mass production reducing the cost to much more affordable rates. And we see even the mass players like Samsung or LG jumping onto the bandwagon, getting on much more simpler, cooler robots to homes, to the consumer points. So I think towards end of the year itself, we'll start seeing an array of new kinds of people being much more aware about robotics. Even during pandemic, we see that people are open to the traditional robots, which were the vacuum cleaning robots. Now it's like if you open up Amazon, you have like 10 more companies who are providing the same robots who've been doing it for over years. But now there's an increased array of interest over there. So yeah, I think we'll see a lot more interest going forward.
Yeah. And what about your thoughts, Ayesha?
I think we'll definitely see a lot more that's happening. I think people will be more accepting about robotics in healthcare where they're aware, but I think the true journey is actually in education and building trust. Because when we think about healthcare in non-first world countries, right, it's still very human dependent. And I have seen that emerge as a pattern over the last couple of years, where yes, definitely when we're looking at surgery, I think there's a lot of trust that's placed in robotics. But when it comes to just fundamental logistics, the understanding is that humans are more dependable because they will understand a particular instruction a lot faster. Whereas when we are talking robotics, we have set patterns, we have set schedules that we will be adhering to. And while I'd love to think that our medical infrastructure is that structured, I don't think we're right there yet. So I think a lot of time is actually going to be spent in the next 6 to 7 months in just educating people about what are the different applications that you could push forth with. And this is not going to percolate down to the, like the larger cities or the larger institutions alone. This is something that has to percolate a little deeper for it to actually be effective. And with the prices coming down, I think it's a very viable alternative for people to be educated about as well.
Yeah, I completely agree. I think one of the things that I'm also seeing in parallel is beyond some of the pricing of the actual robotics, in addition, the rise in sophistication within AI and the software. Mm-hmm. Like Absolutely. You said, you need to have trust, and I think, the reality is, like you said, a lot of program is based on, black and white, yes or no. Yet, especially in the healthcare system, there's so many potential variables in terms of patient care and challenges, right? So
Absolutely.
A robot might be more black and white, but the reality is we live in a gray world. Somewhere Absolutely. In the middle.
And I think especially when you're talking about a career that is in medicine, I think a couple of people we might have on the panel would also agree. It's a very empathy heavy job. So when people start thinking about having another automated machine over there as compared to having an individual, there is a natural amount of reluctance unless you're used to that thing right now. And when you're talking about people in the medical section, people are used to equipment. People aren't really used to having an entity which is running around on wheels yet, right? They're just like, okay, that is not in our regular scope of what we see. And getting them comfortable, I think getting anybody comfortable with new technology is in itself quite a journey. And I think over here with healthcare, which is such a traditional science, which is so human emotion and empathy heavy, I think it's got to be quite a shift. But Ajay, I think you are the person who'd have the insights on this. How's that journey been for you?
Which one? The going from
About educating people about the varied applications.
Yeah, well, that that has come in phases. Like the phase where post COVID and pre COVID would be completely different.
Mhm.
People would be looking forward to talk to you, trying to understand the need for robotics, which is what I was kind of bringing in, where saying we kind of get a part of need
Yeah.
from the the fact that COVID is there, and the fact that there is increased focus on how we can utilize new technologies to get away.
Mhm.
When we don't have answers for, we are looking for towards anyone who's giving answers, right? But back then it was at a point where we had to convince and show to them why it matters and why there's a need. So obviously there's a massive shift in terms of how we approach and how reciprocative people are towards robotics in general, or healthcare specifically when we talk about our products.
Fair point. So, Kevin, were you about to
Yeah,
say something? I'm sorry.
yeah. I was just gonna say, I look back at, how technology's been adopted, in some different markets, and I always look back at when Steve Jobs first introduced the iPhone, and it just, it was so at the time, but there were also so many challenges with their initial device. And you can see how, again, over the past decade, that's just that product alone has evolved, And I think, at least my point of view, I feel like robotics in healthcare is at a similar inflection point where
Mhm.
you're just starting to introduce a new technology, and that this is really the beginning, and that it's going to continue to get better and better and refine itself, both on the hardware side, the software, AI, that whole integration. For me personally, I think that's what's so exciting about this space.
Absolutely. Absolutely. I think in terms of the applications and how it grows, um, it's crazy. I think once people are a little more accepting, and once people see this in certain places, perhaps, and they see early adopters being a little confident about it, I don't think this is going to be much of an issue. But that initial, in B2B SaaS, we always say that it's about the first 1,000 users that you've got to get on board. I think that's the struggle that we've got to cross over here as well. So, but finding those first 1,000 adopters, which is going to say, yes, this works for us, and here's why this works for us. And once that's done, well, after that, it's just about iterations, isn't it, Ajay?
Yeah, you start small, you grow you grow big.
True that. Very specific. So, what are some of the applications that you're seeing right now? As in, have you seen any extremely unique use cases, something that you didn't expect? Because I remember earlier I think around this time last year, not last year, I think early last year, we were still stuck at load testing and making sure that people are able to, the machine is able to actually maneuver and move around in the right manner as well, because you've got those various issues with just how the hospital's built, aside from everything else.
um, I think the products usually evolve once we take it to the market. So we have the disinfection robots which we had for a long while, right? And they
Mhm.
were being disinfected in the same way. The person used to take it into a room, put it out there. The head used to spin around and disinfect the room. But as we move forward, we realize there's an increased sense of trying to understand. So the hospitals are like, oh, my people are doing this, but how do I
Okay.
know that whether they are doing it well, or how do I know whether it's actually disinfecting? These questions about compliance, about effectiveness, only start coming when they start using it. Right now, they are increasingly worried about how well they are disinfecting. So if they have 10 employees, they want to know how well each one of them is doing. Now, these are things which we never really see from outside, where, when we think about robotics, we'll say, oh, it'll do one particular feature. It'll go to a room, disinfect, that's it, right? But we don't know the features that are kind of to be included unless the customers start using it. Now, when they
Mhm.
come back with the questions of, can you measure and tell us how exactly, which place you disinfected well? Was the bed disinfected well? Was the chairs, tables disinfected well? Were the bathrooms a possibility where you could have disinfected? So all these questions comes in and gives us, the ideas to innovate further. And this is primarily where we'll be innovating further as well. So we'll talk about that. That's the reason I was talking about the shifting of how we would talk about robotics. We now talk about delivery as the feature. We talk
Yeah.
about where to deliver and what to deliver. If it's delivering of UV, then where all to deliver it, right? Do we deliver it properly on the bedsides? Do we ensure that the bed is completely disinfected? Do we ensure that the bathrooms are disinfected? Do we ensure that there is compliance being maintained, which these hospitals can actually show to their customers, and hence gain their trust further? So going forward, I think the features, the innovations that come across are more and more something we can only see once people start using it. The new
Mhm.
innovations we can even imagine once they start deploying it in their premises.
I love it. So it looks like you've already got the goals cut out for the next couple of months, isn't it? It's just about getting those that amount of
Yeah.
adoption done, and then you've got those use cases, and then you start optimizing, and the cycle continues after that, right?
Oh, we have for years, but then you can't plan for years with COVID related stuff, coming in and changing everything.
True, and I think COVID is just one of the many things that we're going to see. I'm sure that this it's always been a very drastically volatile space, I would say, when I look at healthcare. There is something that is definitely the buzzword today, and I'm sure a couple of months down the line, it's not going to be just COVID, right? I think, again, India is a very good use case, because when you start talking about disinfection, and we've got this entire conversation going on about, like, say, black fungus spores that are around in rooms, and people are worried about that, about how hospitals work. And then when you actually percolate down to being able to deliver some sort of, say, non-human disinfection mechanism, just simplifies that problem, right?
Yep, absolutely.
Perfect. So lots of different use cases coming up then for
So,
you.
Kevin,
How's Yeah,
sorry to cut you off,
no
Aisha.
worries, no
That
worries,
has
please.
popped in my mind. So, Kevin, we have the Brinc Make division, right? So, how often do we see the service increase over the for the Make division for robotics side, especially different.
Yeah, so I think it's a really good question. I think earlier you made a good point that prices are coming down, right? And in the beginning, you needed fully customized solutions. I think what you're seeing more and more now is, you could leverage an existing robotics platform as your base, or the motor, or certain aspects of the device that will help you save a lot of time, as well as initial cost, to be able to launch a semi-custom solution. So for me, I think, with a lot of different industries as well, of course, every solution is going to be slightly modified or different, but there's a lot more that you can leverage that's off the shelf, which it enables many more companies to think about how they want to deploy their solution, and really refine it for the user experience, right? So, like you said, the way that hospitals are going to adopt this technology, it's going to be based on their feedback, their experiences, their pain points, and so it's going to be able to leverage a lot of existing platforms, or players like yourself, to create some of those new solutions. So I actually see the adoption of new robots, new solutions, to accelerate even faster in the future, because you have that foundation, which really wasn't there a few years ago.
Yeah, sure.
Yeah.
You're saying something, Aisha.
No, that's completely fine. So, Ajay, I was actually quite interested in understanding what's the situation and what are the applications when we are looking at specifically the market within, say, perhaps the US. If you're looking at it, have the use cases been very different? Is the ask different over there when you're looking at what you can do with the base, or with generally just having the moving bit of it that you
Yeah.
can push around to different providers?
I think most of the use cases that are implemented, the innovations that come, like every market usually follows eventually. So the pain points might not be very different, but
Hmm.
the solutions might be a bit different, tweaked as
Absolutely.
per the market. So if you talk about Uber launching some, in the US, eventually coming into India, then there will be a slight tweak to it, obviously because of the operational challenges, but the
Absolutely.
pain points, underlying pain points remain the same. There's there's a problem in connecting people, booking cabs, right? So that's the same thing here as well. We do understand that India, China will do have this massive population, so it wouldn't sell the same way as in US, or where where there is a problem for old age, for example, right? In India we don't have. So in a country where there is a problem of old age, the robotics would be pitched in the way that they can kind of assist, and because they have lower there's markets where there is a growing number of old people in the workforce,
True.
and lesser number of young people. I think in Hong Kong as well we have that kind of problem. So when we look at the markets, different markets across the world, they have similar pain points, but they have to be reached in a different
Different
angle,
manner. I
right?
understand.
So that's primarily the truth here. I think.
So I think it was very nice how you opened that question up for me, which is actually where this thought started off from. This brings me to the future of work as we see it, and I'm going to play the devil's advocate here. Are we now going to say that robotics in healthcare is actually going to take over certain key roles, which currently have been handled by humans, and how do you see that change happening for you? Is that a challenge?
The most common question of all, right? Take away jobs.
We love asking it. I think we all have just read too much of dystopian fiction. I think it's just that.
But that's different. Like robots taking over the world versus robots taking away
Oh
the
no,
job.
we're not even getting there. We'll come to that later.
Right. So I would say, see, primarily it's always been whenever we have a new technology, people having massive opposition regarding that, massive worries. So if you are an administrator of a hospital or an organization, let me ask you this: if you are to pay something for a 1 year salary to someone, right? What do you do next year, right? The next year you again have that same budget. You wouldn't decide to actually, if you can actually put the robot and the people to enhance the patient care, right? Would you decide to just put the robot and take away the whole budget away, rather than, see, traditional businesses, we understand that we invest to increase the experience. Now, if we understand that having a person plus a robot increases the experience of the patient, enhances the patient, would you not spend that 1 year of salary, rather than comparing it with the person's salary? You would actually see it as an addition to the experience. So I think even though the robots might enter as saying they would tackle away all the inefficiencies of a workforce of a person, they might not really challenge the person would actually get to elevate themselves. So we have jobs like drone pilots until drones came, right? So obviously we see whenever the jobs are taken away, there'll be new jobs introduced into the
absolutely. But how do you feel that policy is catching up to this? Because has there been any issue where you have seen that the technology is something that people are comfortable with, perhaps, but maybe there is policy in healthcare? I don't know. We would probably have to check with something like the Total Quality Management Division at a hospital, right? But do they have certain structures? Do they have certain policies which actually include such automation within their scope? Because there are such policies for human error, for like fatigue and such, right? But around machinery, I don't think we have still seen any such policy evolve. So is that something that's a point of concern?
I don't think so. So policies can actually come across slowly, because since we have this large segment, like you said, machines, right? And they can stay under the policies for the machines as long as they want, because they do not overlap into the other segments very soon. They do not take away the human emotional part, or they do not take away for a long time. I would say for near future, and especially when I say we are going to complement people with robots and not actually replace them, then I don't see the policies facing a challenge as long as they are seen as machines, right? So as long as they operate as machines, they stay as machines for a long while, it will be. And governments are catching up to it, definitely. You see that there was an introduction of drones not even 5 years back, and we have US FAA already doing trials with Amazon and Walmart doing deliveries of drone deliveries, right? So I don't think it's very far away. Policies won't be able to stay very far away. They will have to bring in, it's only a few years back that we
I
used to say
understand.
blockchain was completely unregulated, and now every government is trying to say something about blockchain. Either they want to ban it or want to bring in some policy, or they don't know what to do, but they're talking about it, right? So it's about that. So eventually it becomes so common in the workforce that they will have to bring in policies when they need it. So that's I
And I
don't
think
think.
we're going to see the same principle that policy over here as well is going to catch up with the technology as it evolves. And it's not going to be something that's proactive just because we are looking at healthcare as a division.
Yeah.
Oh, that's quite interesting and quite exciting. And thank you for that little vote of confidence that there's still a lot of time before that automation reaches that stage where everything's going to take over life.
Yeah, one thing I wanted to add here, it was really interesting. I read an article the other day that as of today in mainland China, there's over 285 million citizens aged 60 years or older.
Wow.
And over 100 million of them live alone. And just to AJ's point, I don't see robotics replacing healthcare for those people. It actually creates a new opportunity where you could provide through robotics more home healthcare solutions. It's
Absolutely.
not that you're going to employ 100 million people to go to those homes and to monitor those people and see how they're doing. So I think for me, again, it's not robotics or humans. It's about how you build the ecosystem together, creating new solutions. And again, for me, just those numbers really blew my mind in terms of just the current scale.
That was a nice idea.
Give me a
Yeah.
second.
No problem. So yeah, I was going to ask AJ, certainly, solutions within the hospital are that opportunity alone is significant, but is that something that you're looking at more now is home healthcare and supporting more home solutions as well? Do you also see this trend?
Going homes would be kind of a consumer market. We won't be going at a consumer market as such as of now, but we still have a lot of work to do back in the healthcare side. Like you said, when you talk about old age homes or the organizations that are catering to this kind of health side of people. So again, that's our target. That will be our focus. We'll be actually expanding across to multiple other segments, which would be hospitality industries as well as the airline industries. So that's kind of our major. Like I said, when we talk about delivery, we are the robot actually becomes irrelevant. The kind of robot we are using kind of becomes irrelevant. So now when we talk about a robot which is going across in the public and trying to disinfect, so we cannot do that, right? There are harmful effects of UV. So we are forced to innovate things which will actually allow it to work inside public. Like while disinfecting, it can move across in public. And so we are doing different innovations, bringing in using arms, trying to bring in solutions which will actually be able to serve more areas and more wider variety of audience. But then that doesn't cater to, that doesn't mean that we are going to create new robots. It again, a different mode of delivery, serving the same people, the same organizations in the most effective manner, right? So yeah, that's our kind of vision going forward.
That's brilliant. But just curiously over here, do you see that journey being or that evolution being slightly different in healthcare? As in, do you see yourself moving, when you talk robotics, moving to something that's a little more agile, that's a little more specific over time, perhaps? As in, do you see yourself involved in doing or replacing some parts of what a doctor or a nurse would need to do anytime in the future, and perhaps such specific applied use cases are perhaps on the horizon, or is that something that we would not want to customize for now?
So, so when you talk about robots, for example, we have seen examples of telepresence robots, right? So robots are like screens mounted on the top of a robot. They'll go in front of a patient and start a video call with a doctor. Now, absolutely, that actually has only augmented how a doctor works, right? It isn't taking away the doctor's job, the doctor can sit at home, take 6 consultations across 6 different hospitals at the same time, while not being physically present. And that actually has only created more different kind of things that these same hospital or doctors and
Yeah,
nurses
it
can.
solved the problem of presence, right? You're suddenly now you're able to be present without losing that critical time because you've got to move around, right? So that is definitely resolved. But I think in terms of customization for specifically for JetBrain or when you are talking robotics, because I understand that when you're talking hospitality or when you're talking corporate, the applications will be a little more broad, right? If I could say that. But healthcare again tends to get a little specific over time. And when you're talking consultations, yes, that is fantastic. But when you're talking procedures, do you see yourself probably in the next 2 or 5 years having to move towards that? I'm sorry, I might be egging you on, but I'm just very curious about seeing where this journey is going.
So you need to see what exists there and how we are going across. So if you look at the surgery side of it, maybe that's what the most critical side of it comes from.
Absolutely.
We have Intuitive Surgical, which has Da Vinci robots, one of the biggest companies across the world, and they are enabling robotic procedures, surgeries for the hospital, for the doctors, right? So if you look at, they are not really away. It's not like a transition where we start doing transportation robots and eventually go to surgery robots. It's like everything exists. We are attacking different forms, different problems of healthcare from different perspective. And when we talk about healthcare robots, we are talking about service. We are augmenting the service of people for the people, right? So that experience is what we are targeting. Obviously, when we talk about the extremes of experience, also it will not be a surgery, right? So I don't think it will not. It is actually a transition. It's again bringing in things where the experience can be enhanced. The service robots industry is completely about increasing the efficiency and the experience for people.
I understand. So I think especially with the amount of load that we've seen on frontline workers off late, I think this is definitely one of the best blessings I have heard about in a long time.
I need to run to the next session, but
no worries at
feel
all.
free to continue. The insights are amazing, and it's such an interesting space. So feel free to continue, but just wanted to say thank you so much.
Thank you so much, Kevin. It's been a pleasure.
All right.
Great.
Awesome.
Thank you.
Bye-bye.